Okay, welcome everybody to this webinar on COVID and kids, brought to you by Invest in Children in collaboration with university hospitals. I'm Rebecca Dorman, Director of Invest in Children and the County Office of Early Childhood. For those of you who don't know, Invest in Children is our community's award-winning public-private partnership focused on young children and their families, prenatal to kindergarten. Here's our mission. As you will see, we work in many different ways to level the playing field so that every child in Cuyahoga County can reach their full potential. That includes, as you see in the mission statement here, building awareness. And today, that awareness is focused on bringing you the most up-to-date information on COVID and kids. In the early days of the pandemic, so much focus was on our seniors, and with good reason. But with Delta variant and having the vaccine limited to youth 12 and above, coupled with the fact that children are now back in childcare and school, that picture has changed significantly, and there is increasing concern now for our children. Information is changing quickly, and our presenters are on the front lines of both the science and patient care, and we are very grateful that they have agreed to share the most up-to-date information available today. We're really pleased to have an all-star panel of local experts to provide us with the latest information and answer our questions on this topic. And let me introduce our presenters. First, we'll be hearing from Dr. Claudia Hoyen. Dr. Hoyen is Director, Pediatric Infection Control of Rainbow Babies and Children's Hospital. She's built her 30-year career in medicine at UH, wearing multiple leadership hats over the years. In addition to her current role as Director of Pediatric Infection Control, she's also co-director for the UH system, as well as Director of Pediatric Innovation. Next, we'll hear from Dr. Amy Edwards. She's Associate Medical Director, Pediatric Infection Control, UH Rainbow Babies and Children's Hospital. Dr. Edwards is a physician in the Division of Pediatric Infectious Diseases and the new University Hospital's COVID Recovery Clinic. Dr. Edwards is board certified in pediatrics and pediatric infection diseases. And finally, we'll be hearing from Dr. Joan Zoltansky. She is Chief Health Officer at University Hospital's Health System, and she is the spokesperson for community and national public health issues. During the COVID-19 pandemic, she has been leading the UH Healthy Restart effort, a team of healthcare subject matter experts who provide medical and environmental health guidance to community leaders as they thoughtfully return to public spaces. So again, we are thrilled that they've agreed to join us do this presentation. First, we will see their presentation, and then we will have questions afterwards. So without further ado, we're going to turn it over to Dr. Hoyen and switch to their PowerPoint.
Sounds great. Thank you. All right, so we're going to spend probably the next half hour talking a little bit about COVID in kids and especially what we know about the Delta variant and what we've been seeing. You know, this last 18 months, for those of us in the medical field, has been like those everywhere. Every day we're learning something new. And so we are just delighted to be able to bring you the most up-to-date information that we have to share with you so that you understand what you can do to keep your family and your children safe as we're entering a Delta surge here in Northeast Ohio. Next slide. So again, COVID is all around us, and it's all about the Delta, Delta, Delta. Next slide. I think probably one of the most exciting things actually in my life as an infectious disease physician really happened just a few weeks ago, as we were so fortunate to have the first FDA complete approval for a vaccine. And so, you know, we now have the Pfizer vaccine, which is FDA approved for those 16 and above. Pfizer's working very hard to get the rest of the EUAs, or the emergency use authorizations, in place for children, and then they'll go for the full FDA approval. But again, we now have FDA approval for those who are 16 and older, and that is just amazing. Moderna is right behind them, and so they'll probably be coming out within the next month. And J&J has not quite yet filed their paperwork, but they were several months behind both Pfizer and Moderna in terms of getting their vaccine to market. Next slide. So, what is different, now in the summer of 21 than when this all started? And really the thing that has been driving these continued surges, these continued outbreaks, is the fact that viruses love to mutate. As they are replicating, whether it's in your nose or your throat, they don't do a very good job of it. They're very sloppy replicators, and oftentimes they'll make mistakes that then give them a selective advantage. And we've certainly seen this. This list is, the most common variants of concern, but I have a whole nother slide somewhere that I didn't share with you that has about another 10 variants of concern and interest. So these things are happening in real time. And what has changed is the fact that as the pandemic started, we had the wild type virus, which was the initial one that came out of Asia. And that then mutated into the Alpha variant. And so that's pretty much what we saw last summer and all through the winter. But as things continued around the world, back in October, we started to see the Delta variant. And the advantage that the Delta variant has is where the mutations have happened, it makes it extremely contagious. And it also gives it a very good mechanism to replicate very much in your nose and your mouth. That's what makes it more contagious. But it also can impact people who are vaccinated. Again, it keeps them safe from hospitalizations and death and ICU admissions. But again, people who are vaccinated can get Delta. That doesn't mean you shouldn't get vaccinated, because again, we need as many people safe and healthy through this pandemic. So Delta, Amy, I know Amy's going to talk more about this, so we'll save some of this for later. The thing about the Delta is you can see I have an 80% on my slide, and that was at a time when I used it in July. So in July, it was about 80% present in Northeast Ohio. I just presented these the other day, and now we're at 98%. Next slide. And if you see our data from UH, you can see that within the last few weeks, it is now 100% of all the sequencing data that we use. So again, Delta has taken over and has changed the landscape. And that's why we're so happy to be here with you today, to be able to explain why and how it's different and how you can keep yourself safe. Next slide. The next few slides are all going to be more of the same. You can see on the right-hand side, the curve is going up. And so daily, there are more COVID cases around the world. Next slide. Unfortunately, you can see the places that are in dark purple are the hotspots, and the United States is absolutely one of them. In fact, yesterday, the European Union decided or was talking about the fact that they are thinking about not letting unvaccinated Americans into the European Union. So more to come. So we are really in the process of another surge. It started down south, as we'll see in the next slide. So again, we're moving up more cases every day in the top right. And then when you see the testing, the hospitalization, and the deaths, you see that those lag a little bit behind the new cases. And it's pretty typical of what we've seen throughout the entire pandemic, because people will typically get infected first. And then as they get sicker, they'll end up in the hospital, in ICUs, and then later on, possibly weeks or months later, pass away. So it's this kind of curve that we're seeing where things are lagging in the hospitalizations and deaths. Doesn't mean it's not going to come. It just means it's going to come later. Next slide. And again, really the people that are in the hospital, not only in Kaiser in California, but really right here in Northeast Ohio, are people who are not vaccinated. About 98% of those who are hospitalized in Ohio are not vaccinated. Next slide. And so this is, you can really see what we've been noticing during this latest surge is that it really started in the South. You know, the hot spots are down South, the risk level is higher in the South. And as you move up, excuse me, you can see that still in Ohio, we're a little bit behind. Down south, we're red and not purple. But in the upcoming weeks, we will be purple as well. Next slide. And again, here we are in Ohio. Like I said, it looks like around the bigger cities where there may be more people who are vaccinated seem to be a little bit behind the rest of the state, but clearly we can see there are certain parts of Ohio that are already purple. And you know, what we want to do is to be able to stop as much spread as possible, because we don't want to overwhelm the healthcare system. It's just crucial that we, you know, keep beds available in our ICUs, whether it's for adults or children. You know, we have seen reports around the country of adults who have passed away from things that, you know, heart attacks, gallbladder attacks, those types of things, because that critical care is not available for them. We know that in other parts of the country, pediatric ICUs are also very busy. And again, we want to be able to have beds and staff available to take care of children who are in car accidents, who, you know, may have other typical things that children get. And so it's really important for all of us to be sure that we're doing as much as we can to keep ourselves safe. And again, you see here in Ohio, we're really starting to move up on the curve as well. Next slide. You know, if you look at the group that's out in the state of Washington, they've been pretty spot on throughout the entire pandemic, you can see that they are predicting that we are going to surge here in Ohio within the upcoming weeks. So probably the third, fourth week in September. And then you can see that the cases will go up, but as we talked about before, the need for beds will be longer than the peak. You can see it's a little bit, that peak is a little bit wider because again, people end up in the hospital and they end up staying for a while. So you know, people are going to be very tired in the healthcare field come midwinter here. And so again, whatever we can do to keep ourselves safe is important. Next slide. And again, we're seeing the exact same thing at university hospitals with an increase in cases. Next slide. And then we've got the vaccines. And again, these are absolutely amazing things. Like I said, from an infectious disease standpoint, I've been doing this for about 25 years. Really absolutely amazing that we were able to take this technology that people have been working on for 10 and 15 years and turn it into a vaccine that we're now able to give to millions of people around the world with relatively few side effects. So it's really an amazing day in medicine. Next slide. You can see the US, we're not the best at getting people vaccinated. We're about in the top quartile there. Next slide. And when you look at the different age groups, again, you know, for everybody fully vaccinated, it's really at only about 52%. And you can see that as the ages go up, we're getting better at those people taking the vaccine. And what we really need to do is to be sure that everyone's protected. Next slide. The one thing that has been happening during the surge is that people, especially in the South, are now starting to get vaccinated. So we're seeing more people taking the vaccine every day, which is really important to get this under control. Next slide. And in terms of what's coming down the pipeline for kids, we know that Pfizer is licensed to be given to children 12 and above. And our friends at Moderna will hopefully have that very same EUA in the upcoming weeks. Johnson & Johnson is really still in the planning stages and the very early stages, and AstraZeneca is not available here. In terms of the younger kids, so 2 through 12, I mean, we know that now, you know, most of the kids in middle school and high school are eligible to be vaccinated, but we know our elementary school kids are still very much at risk and very vulnerable. We're probably still a couple of months out in terms of getting the Pfizer vaccine for them, and a few more months out after that in terms of getting the Moderna. So we're probably looking at the perhaps 6 through 12, probably November, and then the younger kids sometime after that. Next slide. And what are people worried about when they get the vaccines? We hear a lot of concerns, and we completely understand what people are worried about. We know that people have been seeing kind of local reactions in the area of the shot. That's not to be unexpected, and usually is pretty manageable. Some kids have been complaining, typically if they've gotten their second shot, that they may have some fevers, some chills, muscle aches, headaches. Again, something that is pretty manageable. Just imagine if that child had actually gotten COVID, how many more symptoms they may have had. I know another thing that parents are very worried about, and it's understandable, is the cases of what we've heard of some children, usually boys, adolescents, young adults, who've developed a myocarditis or an inflammation of their heart muscle from the vaccine. I can tell you, and I'm sure Dr. Edwards would agree, that the children who get COVID can also get myocarditis. But the children who get myocarditis from COVID on average are much, much sicker. And it's a much more frequent happening than those who get it from the vaccine. So if you, talk to an infectious disease specialist or anyone who's in public health, we are really going to recommend that actually it's safer to get the vaccine than to get COVID. And we're happy to take questions about this. All right, next slide. Where can you get a vaccine for you or your children? At UH and Rainbow, we are starting to move them out into the primary care practices. So stay tuned as we're moving into the future. You might just be able to go to your doctor's office and get it done. I know there are a couple of practices already in pediatrics. And again, it's going to be something that really becomes very routine for all of us. As you know, there are pharmacies. You can look at county resources. There's lots of information on the websites, and I'm sure the Invested Children people will be happy to supply those. I know we're all hearing a lot about boosters as well, and it's really only for the mRNA vaccines, so really Pfizer and Moderna, that we're looking at having people boosted. J&J will probably also have a booster at some point, but again, they're a few months behind in terms of their data. The people who should get boosters now is anyone who's immunocompromised. So anyone with a history of cancer or chemotherapy, certain diseases like rheumatoid arthritis, where you may get certain medications. Your doctor can help you decide if your youngster is someone who's eligible. And then for the general population, so for people over 16 with the Pfizer vaccine, the boosters will become available sometime probably mid-September, so just a few weeks away. The important thing that we're starting to learn, we know there's a lot of people who feel, well, I've had COVID, I have immunity, I'm going to be fine. Chances are you will be fine, but we are starting to see that for people who've had COVID and decided not to get the vaccine, they are about 2.5 times higher at a chance of getting reinfected and becoming ill with COVID. So again, for some reason, the vaccines just are doing a really great job at stimulating our immunity. The immunity seems to be much stronger than what you get from natural COVID. And so for all those who are eligible and can be vaccinated, again, we encourage that you talk to your doctor and find out what's best for you. Next slide. All right, Amy, you're on.
Yeah, thanks, Claudia. So I am, as they said, I'm a pediatric infectious disease doctor. I do a lot of clinical work here at Rainbow. So I'm really going to kind of drill down on what we see when kids come in with COVID, and then I'm going to talk a little bit about the consequences of COVID infections in children. So what do we know, like what is the real life experience for you as a parent if your child were to get COVID? We know that a good chunk of those children are going to be asymptomatic, and that's fantastic. I mean, that's what we prefer, is kids not getting sick. If you know, whenever possible, that's kind of our goal in life. But we do know that of all the kids who test positive for COVID, so kids who were screened either because they came in contact with somebody or who have symptoms, we know that somewhere between 2 and 4% of those children are going to be sick enough to need to be in the hospital. And of those kids who are sick enough to be in the hospital, about a third of those children will need to spend at least some time in the ICU. Generally speaking, kids are admitted because they need a little bit of oxygen. They're having a little bit of trouble keeping their oxygen levels up, or they're dehydrated. We all know that, especially with our very young kids, when they get sick up here and they're having the runny nose and the trouble breathing, they tend not to drink as much, and kids are more prone to dehydration than adults are. And so that's kind of the primary reason that kids end up needing the hospital. For our asthmatics, it's the typical, you know, they need to come in for albuterol and things like that, because COVID, much like any other respiratory virus, can induce an asthma attack. Generally speaking, from a symptom standpoint, we see a lot of the same types of symptoms in kids that we see in adults. So we see the fever, we see the shortness of breath, we see the cough, the sore throat, the runny nose, abdominal pain, vomiting. Believe it or not, kids can get the loss of smell and taste that adults have been reporting. So that's another feature of COVID that we have to deal with in kids. And unfortunately, we do know that greater than 400 children in the United States under the age of 18 have died of COVID. So it's certainly nothing compared to the adult numbers, for which I am grateful every day that kids are not suffering from COVID in the same way that adults are. But it's not nothing in children. There are two major complications that we see in children with COVID-19. One of them you may have heard of, using the letters, we call it MIS-C. It's multi-system inflammatory syndrome in children related to COVID-19. And I'll get a little bit more into that. And the other complication that we see in children is long haul syndrome. And we'll talk about that in more detail as well. Next slide. Next slide. Okay. Well, I know it's on the next slide. So the next slide is really going to be talking about that multi-system inflammatory syndrome in children related to COVID-19. So basically what happened is in the spring of last year, there we go, in the spring of 2020, all of a sudden there were all these reports of this new inflammatory syndrome. The kids weren't sick with infection, but their bodies were inflamed as if they had had an infection, and they were coming in really sick. And all of a sudden everybody's like, what is going on here? Eventually we were able to determine that it was related to COVID-19 infections. And basically what happens is the kids get COVID, and in the vast majority of cases of MIS-C, it is asymptomatic disease. Most of the kids that I have seen, and my fellow infectious disease doctors all over the United States, most of the kids that we've seen with MIS-C have had extremely mild or even asymptomatic disease. So it's having MIS-C is not related to how severe your original COVID might have been. So the kids get COVID, they get over it, and then about 4 to 6 weeks later, they suddenly get sick again. They have high fever, they might have a rash, the white part of their eyes might turn red, they develop some sort of GI symptoms, severe belly pain, vomiting, diarrhea, something like that. It's not clear what % of kids who get COVID will have MIS-C, because so many kids are asymptomatic and aren't being tested. So we don't really know the true rates, but it does look to be somewhat rare, maybe less than 1%. And that's encouraging, right? You think, oh, well, less than 1%, except the flip side is that the vast majority, greater than 3/4 of the kids who get MIS-C will end up in the ICU. So while it is a rare complication, it's a very serious complication, and these kids come in very, very sick. And I can tell you from my own personal experience, you know, these kids are often in the ICU for multiple days. Some of them need breathing machines. A lot of them need medicine to keep their heart going and to keep their blood pressure up. So it's a rare complication, but it's a serious complication. These kids are really, really sick. And we do not know all of the reasons, like why do some kids get it and other kids don't? We have no idea. But what is very clear from the data is that minority children are at increased risk, particularly Black and Hispanic children, for reasons that we don't really understand yet. Next slide. So the other major complication that we see in COVID is long haul syndrome. I'm sure you guys are all familiar with this. It's kind of all over the news. We first saw, cases of it summer of 2020. There were adults who even maybe had mild cases of COVID who just weren't getting better the way you would expect. I mean, we all get colds, right? We get colds, we get flu. Yeah, you're sick for a while and then you get over it, but that doesn't happen with COVID. And it looks like anywhere from 10 to 15% of patients who get COVID will not experience a full recovery, even if they have mild disease. The symptoms are vast. Upwards of 40 to 50 different symptoms have been associated with COVID long haul, and we're not going to go into that in detail. But primarily, we're seeing a lot of fatigue, shortness of breath, new onset headaches or migraines, sleep disturbances, GI tract disturbances, difficulty eating, difficulty with constipation, that sort of thing, and a massive variety of other symptoms. This is now known as COVID long haul syndrome, and millions of Americans are known to be affected. In the last 9 months or so, it's become clear that while COVID long haul is less common in children, children are not immune to this and they can get COVID long haul, in response to which we have here at UH opened a COVID recovery clinic for children in parallel to our adult COVID recovery clinic. And we are starting to see primarily teenagers come in with COVID long haul. And it is most common in teenagers, but there have been case reports going all the way down to 3 and 4-year-olds with COVID long haul, but that seems to be incredibly rare. We do not currently know what the long-term outcome for these patients will be. It's too early. But there was one very small study, but encouraging nonetheless, that shows that COVID long haul appears to be less common in vaccinated individuals, which is very encouraging. Even vaccinated individuals who get mild breakthrough disease, they seem to be less likely to go on to have long haul COVID, which is very encouraging. Next slide. So what do we know about the Delta variant? Dr. Hoyen touched on a lot of this. It first came out in 2020. It is primarily responsible for the devastating outbreak there, for any of you who saw that on the news. So there's a couple of things we know about it. We know that it's easier to transmit. We know that that's because you have higher viral loads of Delta than with prior variants. So like in your respiratory tract, in your nose, in your mouth, in the back of your throat, you have more virus than you would if you had caught like Alpha variant or even the original parent strain. And so because you have more virus, that means every time you cough or sneeze or breathe, more virus is coming out. Thus, it's more contagious, right? It's easier to spread. We also know that the Delta variant binds to our cells better, more efficiently than prior strains do. And even better, so viruses replicate themselves by using our own cells against us. They enter our cells and use our cellular machinery to make copies of themselves. And it turns out the Delta variant has figured out how to do that even better than prior strains. So it's more efficient at taking over your cells and making more copies of itself. So all over, Delta variant has just figured this out better than the prior variants. And that's why we're seeing that it's more contagious. And unfortunately, it also appears that it causes more serious disease. So when compared to prior strains, you have you're 2 times more likely to be in the ICU, you're 5 times more likely to be in the hospital. So the Delta variant is just nastier. And it appears, unfortunately, that is true in children as well, that they can have more severe disease from Delta variant than prior variants. And you have heard people say that vaccinated individuals can get breakthrough infections with Delta variant. That's absolutely true, but it is milder. You're less likely to be at your, gosh, what is it, 6 times less likely to be in the ICU, 3 times less likely to be in the hospital, and 10 times less likely to die, or it's just massively, overwhelmingly better. We also know that while people who are vaccinated can still shed the Delta variant, in other words, they're still contagious, they're contagious for a much shorter period of time. People who are unvaccinated are contagious for somewhere between 10 and 14 days. People who are vaccinated appear to only be contagious for about 3 or 4 days. So there's a lot of benefits to being vaccinated. Next slide. And this is just that data again. So this is the actual published data on the CDC website. For anybody who's interested, the CDC publishes all this stuff on their MMWRs, Morbidity Mortality Weekly Reports. It's open to the public, so anybody can look at this. And this is just looking at whether the vaccine is still effective against the Delta variant. And basically, I would just point out a few things, and that is that if you look at COVID-related hospitalizations, the vaccine efficacy is still very high, somewhere in the high 80s to 90%, and that did not change over time or with the introduction of the Delta variant. This was in study 2 looking at hospitalizations. The one place where the Delta variant seems to be causing more problems and the vaccines aren't working as well as in our long-term nursing facilities. So skilled nursing inpatient facilities are also known as SNFs. And that was the impetus for the introduction of boosters in those high-risk populations. And then the third study was looking at the entire state of New York. And again, we see vaccine efficacy related to hospitalizations is holding steady. It's just you're more likely to have an infection, but you're not necessarily more likely to be admitted to the hospital according to the data. Next slide. I believe that's all from me. On to you, Joan.
Okay, well, thanks. And much of what we'll talk about right now is what can we do. So there's a lot of information here that we want to try to understand and then also try to prevent our children from getting some of the illnesses that we talked about. So when we think about how we do this, we'll go to our next slide, please. We think about we hear these things, you think, well, why don't you just stay home and not go anywhere? Why don't we just keep the kids home and all of us stay home? Well, we're talking a lot right now about children moving back into public spaces, back into school. And why do we do that? Why do we take these risks around COVID and move back into public spaces, including going to school? And it's a lot of this is because we recognize the need for children to be in public spaces, to socialize. And so what we want to think about is as we do this, here's one where we think parents are saying that their children are falling behind academically, falling behind in social development, experiencing mental health and behavioral problems. And so when we think about going back into public spaces and socializing, those types of things, we want to think about what can we do to do this in the safest way possible. We can't do any of it perfectly safe right now, but what are the measures we could take? Next slide, please. When we talked about this since the beginning of the pandemic, since almost the very beginning of the pandemic, we've been talking about some of these same public health measures. So masking. Many people thought over the summer, the masks are off and we're going to go back to no masks. Unfortunately, we still are with masks and we're still recommending masks for when you're in public settings. Still those same things. So I put this up here to emphasize that these are not new concepts and how we try to prevent this. So the masking, the symptom checking, the cleaning of your own hands, cleaning of your own space. And when I put that cleaning there, I always think about cleaning the air in some sense, meaning more air, more space is better than less. So outdoors, so cleaning your hands, your own person, but also thinking about your environment. And the cleanest, quote, cleanest environment is really outdoors, to be in the outdoors right now. And then also that physical distancing and as much as we possibly can. And so those are the measures that we try to think of. And then we also think about, if you go to the next slide, please, there are people that we don't want to physically distance from, right? Which is our kids, our families. We want to be close and, we want families to be together and close, but we have a lot of questions. And I'm certainly, Dr. Edwards gets them and I do. What can we do to protect people even in our own households from COVID? And so when we think about that and we think about even in the public health space, so our own children, our own personal health space, what we think about how we can do that the best is vaccination. And so you physically distance all the time from your family. You can't be masked all the time inside your own household, but still you want to protect your children because you're out in the community. So that's where we're talking about vaccination and recommending vaccines for parents, even when your own children are not able to get vaccinated, because that's often the question is, my child who is 6 isn't eligible for a vaccine, how can I protect them? You can help protect them by getting vaccinated yourself. If you go to the next slide, please. But yet we still see that people are not always ready to get vaccines. They're hesitant. And I think the first thing that I want to say about that is that we respect the fact that you have concerns about it and concerns about safety and concerns about your own body. And we want you to talk to your healthcare provider about those concerns. So, we don't want to be dismissive of those concerns and dismissive of your hesitancy. We want to address them head on with you. Kaiser Family Foundation is an organization that really works hard to keep a pulse on challenges. And so even though you may hear some of this in the media, I also like to talk about it directly too, because sometimes people think that if someone is vaccine hesitant or they're not ready, it's just about conspiracy theory. But actually people have real concerns about their own health, about their own personal safety, about side effects. And that's a valid concern to have, and that's what we want to address. And so sometimes when people compare the vaccine, they're comparing what if I get the vaccine versus if I do nothing, then what are the effects? But what we want you to do is compare the vaccine versus COVID itself and look at those effects. And so if you go to the next slide, I love visuals. And so this is a visual. This is not up to date as of right now, nor Ohio. I picked this one because it's a common visual and I didn't have the visual representation for Ohio. But it really speaks to the data that Dr. Edwards and Dr. Hoyen were talking about, which is when we look at the number of cases, when we look at hospitalizations, and we look at deaths in people, they're happening for the most part in people who are unvaccinated. That's not to say it doesn't ever happen in someone who's vaccinated, but for the vast majority, this is people who are vaccinated. So when you're comparing the vaccine, again, we don't want you to compare the vaccine with nothing. We want you to compare the vaccine with COVID and think about which one is worse. And you can see from the cases, from the hospitalization and the deaths, this has many more effects on people who are unvaccinated. If you go to the next slide, please. And so there is also what I'm hearing recently, and I hear when I'm talking out in the community to organizations, people are asking about boosters, and they're saying, well, if there's a booster, is the vaccine itself really good if you need a booster? So they're saying that, so this is one question about booster, but also I'm hearing the question about boosters. If the vaccine is so great, why do you even need a booster? And how many boosters are we going to need and those types of things? And so I put the next slide in as a reminder that many of the vaccines that we have boosters. So the COVID having a booster, the COVID vaccine having a booster is not unique to this type of vaccine. When you take your child to the pediatrician, they're getting boosters throughout many visits in the course of their childhood. And also we get boosters as an adult with our influenza and those types of things. So it's not unique to this, and that shouldn't cause you to have concern about the COVID vaccine itself, the fact that it needs a booster. If you go to the next slide, please. So just as a reminder to wrap up, you may have seen this kind of Swiss cheese model, which we say this is really about layering. So layering this masking, the physical distancing, the hand hygiene, masking, and then now we fortunately, unlike last year at this time, we didn't have this final layer of protection around vaccines. And you can see there's this vaccine layer, and you can see all the other ones have larger holes and more holes. And the vaccine is the one that has the smallest hole, meaning this offers the best protection, that the vaccine offers the best protection. We want you to do all of these things, but the vaccine offers the best protection. And I think that's my last slide. And I think Claudia put one in here. This must have been a physical distancing one. Dr. Hoyen put in a physical distancing one for all the ways that we can be creative. Maybe this slide also jogs my memory. Claudia, do you want to speak to this one? It's cute.
It really, I think it's pretty much everything we need to do to keep our kids safe. This just makes me giggle every time I see it. Again, you can see the kids are masked, they're in school, they're with their friends, and they seem to be doing okay. So lots of children around the world are experiencing what our children are, and we know that children are amazingly resilient And, if we're there as adults to support them with loving relationships, we'll all get through this.
Thank you all so much. And it was so much information. I want our audience to know that this is recorded and we are going to make the recording available. So you will see it all, including the PowerPoint, before I go on. So we did get a few questions in advance from registrants. So let me ask you some of those. And then we had some live as well that I think you all can see too. But let me start with a few that came in prior to today. There are a lot of children in the community with asthma and other respiratory vulnerabilities. Are they at higher risk if they were to contract COVID? What can you tell us about that?
Yeah, we do know that asthma and other respiratory illnesses or other respiratory problems are a risk factor for severe COVID, but it's more in the sense that they're a risk factor for more severe outcome from any respiratory infection. It really, a lot of it depends on how fragile your respiratory system is. So I've seen some asthmatics come in with COVID and they do fine, just like they do with other respiratory illnesses. Yeah, they need a couple days of albuterol. They maybe need a whiff of oxygen here or there. But then some of our more fragile asthmatics who come in with COVID, really do have a lot of a harder time. So some of it really does depend on your underlying respiratory health.
Okay,
if that makes
sense. Yes. So there's certainly, you talked a lot about masking, and we know about masking indoors. What about masking outdoors, especially unvaccinated children? They're on the playground, they're eating lunch with each other. What's your advice on that?
I would say do your best. I think that certainly the CDC recommendations are now when children can't physically distance, they should be masked, whether they're indoors or outdoors, with the spread the way it is and with Delta the way it is. It's certainly challenging, when children are outside and together to try to distance as much as possible, but that's why if you have that extra layer of masking, it's a good idea right now.
Okay. And you talked a lot about the booster at the end. Can you explain, is the booster another shot just like the one you had before? It doesn't have a special new formula in it. It's just an additional dose of the same thing. So there's nothing new that we wouldn't know about it. Is that correct?
Yeah, and I can explain a little bit more about the science there. So Pfizer and Moderna both actually did look at doing like a special booster with like mRNA for like the Delta variant or other variants, and looked at that compared to just like a booster from the original. And the basically what the science showed is it didn't really matter. You just needed to boost the neutralizing antibodies back up to a higher level to overcome some of the problems that the Delta variant was presenting. And so that combined with the complexity around manufacture to try to have, manufacturing the original vaccines plus these special boosters. And then what happens if there's another mutation, like the Lambda variant or some other variant, that now we have to account for that. And so it, given that the studies that they showed didn't seem to matter, that you needed the booster to be more like specific to the Delta variant, and for manufacturing efficiency, we went with it's the same shot. So it's the same one that you already got.
Good.
Yeah.
Okay. I think there's a lot of confusion about that. Okay. Yeah. I'm looking through some of the questions that came in today. So can you talk about the usefulness of the rapid antigen COVID tests and the ones that you do at home? What's the efficacy there? What are your thoughts?
I think when you think about at-home testing, one of the things that you want to make sure to understand is that's for people who don't have symptoms. So that antigen testing is what we call screening test, and it's for people who don't have symptoms, and that's how we use it. And so if you're doing that at home, if you have any type of symptoms at all, you'd want to go to your doctor and get a different type of test, a PCR test, for if you have symptoms.
Okay. So a lot of questions about the vaccines. This person asked, I want to confirm that you said that vaccines will probably be available for 6 and up in November, not 5 and up.
Yeah, I think Claudia probably misspoke. So I actually talked to somebody last week, and from Pfizer, and they're going to be submitting their data for 5 and up to the FDA. Their aim is for this month, or not quite this month, September. Starting tomorrow, it'll be this month. They're hoping to get the data for 5 and up to the FDA in September. And if you go back and look at prior EUAs, from data submission until EUA approval has been between 4 and 6 weeks. So depending on when in September Pfizer is able to get that data to the FDA, then we would estimate about 4 to 6 weeks past that would be when we would see the EUA for 5 and up. And that is, so the earliest I've heard that anybody would expect that is Halloween, but I think most people are thinking early November. And then for 6 months to 5 years will be 6 months to less than 5 years. They're hoping to submit the data to the FDA December or January. And then the EUA for that would be, again, about 4 to 6 weeks later. And so that's the time frame. And I got that information from somebody from Pfizer last week. So that's the last I've heard. Now, these are all rumor grapevine type things, but that's what I heard last week.
Okay.
Thanks, Amy, for updating that. That's fantastic.
Yep.
Okay. Yes, thank you for up-to-date info. There are a number of questions from adults who are vaccinated, but still very worried about being a risk to their unvaccinated children or grandchildren inside the house, etc. You touched on that a bit, but what's your best advice? I've got, a nervous grandmother, a nervous parent. What would you say to them? Because obviously the last thing you would ever want to do is be a risk to your child or grandchild.
Right. As we know, things are so much different this year. The roles are completely reversed because last year it was us trying to protect our elders. And now the roles are reversed. So I think that the really important thing to do is to remember that, if you're an adult and you're going out to work, if you're inside, wear a mask. If you are attending a function as an adult, if it's inside, even if it's a social function, wear a mask. Do those things that we know work. To decrease your chances of exposure so that you can protect your kids. Joan, I know you talked to so many people about this. Anything else to add?
No, I think that's right. The CDC, when they talk about small gatherings, that's what they're talking about, is someone that your circle who you regularly socialize with. And certainly with the Delta, adding those layers of masking, if you can do it outdoors. Yep. But certainly thinking about it a little bit beyond right now with the uptick.
Yep.
Okay, thanks. Questions about pregnant women. Are they going to be prioritized for getting a booster? And also about if you're breastfeeding and you've been vaccinated, do you pass on any protection to your infant?
Yeah, there have actually been several studies that have shown that COVID antibodies pass in breast milk. So that's fantastic. And it seems to provide some protection to those very youngest kids. COVID in that sense is like any respiratory virus. And we know that the antibodies that pass in breast milk are particularly good at fighting respiratory infections because it's a specific kind of antibody called IgA, which is really, really good for the respiratory tract. So there have been a number of studies that have shown that, and that's been fantastic to see, which is one of many reasons why we're encouraging pregnant women to get vaccinated, because then they can pass those wonderful antibodies on to their babies. And I don't think that the booster shots, Claudia, correct me if I'm wrong, but I don't think the booster shots are going to be prioritized the way the original was. It's more going to be like right now we're prioritizing them for the very medically frail and immune compromised, but then on September 20th or
yep.
It's going to be everybody who has had the shot, their second shot more than six months ago or 8 months ago can now get a booster shot. So I don't think we're making priority groups for the booster.
Right. And
Oh.
again, we just know that when pregnant women become ill with COVID, there is a percentage of them who will become seriously ill, and have side effects not only for themselves, but we've certainly known of cases where, mothers and babies have been lost. And so whatever we can do to work with pregnant women, we know that the studies are ongoing now in pregnant women. There's great data even from the first studies where women who didn't think they were going to get pregnant entered the Pfizer and the Moderna study and then became pregnant. And those pregnancies and those children have been followed for almost a year now. And there really have been no complications. So again, the vaccine is truly safe and effective, not only in pregnant women, but in their unborn babies. And so we just ask, knowing how tragic it is to see a young family without a mother or without the baby that they were expecting, and just hope that people do whatever they can to stay safe.
Okay, thank you. So a question about preschool. In fact, at the end, I'm going to show a slide about our universal pre-kindergarten program, the gold standard of preschool that we fund in our community, but concerns about keeping kids safe in preschool. And certainly that, you've talked about, we know there's risks and benefits, and all the benefits that children get from preschool. That's what we talk about all the time. What would you say to parents, though, who are concerned about sending their kids to preschool, knowing the limits of masking and the realities of how parents and younger kids too, obviously, how they interact in that setting?
I think it's like all schools, there's risks and benefits, right? I mean, the only risk-free is to not do anything. You weigh it with the benefits of social interaction and education. But I do think that encouraging the adults, the people who are around the children, as much as we possibly can to get vaccinated, that's the best way to protect the children in those places and spaces. And then also, again, layering on those other measures where if they are old enough for a mask, those types of things. But I think really, again, that I would hope to see that the staff who's taking care of them would be vaccinated.
Would you be concerned about surfaces at this point, sharing crayons? And that was one of the questions, kids' toys, or do we know that that's really not, surfaces are not of concern at this point? We know enough about, and including Delta variant, that that's not the concern.
I wouldn't say it's not a concern, but it's not the primary concern. So you'd want to do just as you would, with colds and flu viruses, you'd want to, wash hands as much as possible and clean surfaces as appropriate, but not the biggest area of focus.
Okay.
And again, the younger the children, the more likely they're going to contaminate something. So, in little less worry, of course, in the high schoolers and the other kids. But again, as you're moving down those age groups, really trying to be sure that you're doing frequent hand washing.
Okay. And I just want to, for people who joined late, this all is going to be available through our website as a recording. So you will be able to go back and look at all those slides again and hear all of this wonderful information. I know we will not get to everyone's questions. If someone has there are a lot of very specific questions that I know we won't get to. What would you suggest? Should people reach out to their own healthcare provider? Does UH provide any other resources? What would you tell folks?
Certainly, your own doctor can help you, work through some of those questions. And also, it is complicated. It's complicated. Yes. The advice for travel and schools, vaccine versus unvaccinated. But if you have a question, vaccinate, mask, distance, wash your hands, all those kinds of things as you can. Less people rather than more, but as far as individual, you can work that out with your doctor.
Okay. Yeah.
And I can tell you if your pediatrician is a UH provider, and and you have very specific questions that even your provider can't help with, a lot of the UH providers have been reaching out to me and Dr. Hoyen to run through specific patient scenarios. And so that is a route that your pediatrician has available through the UH system if we need that.
Great. There are a bunch of questions again about vaccines, mixing, matching, and do you have worse reactions to the booster, anticipating that? Any thoughts about that?
The studies show that the third dose is the same as the second dose. It's a little more vigorous than the first dose. And the FDA recommendation is to get the same booster that you started with, but that if you're having trouble with booster availability, you should boost with whatever you can get, rather than waiting for one to become available. Although I don't think availability is going to be a problem in the United States. Hopefully, I don't really know. I did see one question that was specific to somebody being in a study. And I would say if you're in the Novavax or Pfizer study, you need to talk to your study coordinator about getting the booster, because they will probably boost you.
Yeah, and so as people are starting to roll out the boosters, I know that here at UH, we'll have Pfizer days, there'll be Moderna days, and so when you call to schedule your booster, make sure you have your vaccine card available so that you can give people information and be sure that you're ending up in the right location.
Okay. And there were a couple questions related to the myocarditis. One is in general, how long it lasts. And there was one about children. We know many kids are on ADHD meds, and I'm trying to find that question too, if that, is there a risk for them with?
So I actually have been doing a series of educational lectures on myocarditis with some of our cardiologists here at UH, and we've been working together on this very closely. So what I can tell you about myocarditis, I'm gonna do it on two different ways. First, I'm gonna talk a little bit about the virus, and I'm gonna talk about the vaccine. So in healthy kids and young adults, we know that somewhere around, it can be as high as like 10% of people, even with mild disease, can have some amount of myocarditis. For mildly symptomatic or asymptomatic, the myocarditis appears to last for up to a couple of weeks, and most of them do resolve without too much trouble. For the kids who need to be in the hospital or even in the ICU, we see more severe heart disease in a higher percent, and it can last for a while. We don't know 100%, right, because it hasn't been long enough to know about like full resolution, but many of those do end up on like significant exercise restriction and more long-term medications. Then there's also the MIS-C. So like I would say about 80 to 85% of kids with MIS-C are going to have some amount of heart symptoms, whether that be poor heart function or myocarditis, or heart rhythm problems. Those do appear so far to eventually resolve as far as we can tell, but we don't yet know what the long-term complications. So that's the picture about the heart with COVID. And then with the vaccine, it seems to be pretty rare. So for every 100,000 kids who get the vaccine, we're looking at a couple of cases of myocarditis. So it's pretty rare. It's pretty mild. Most of them are able to stay outpatient. It usually only lasts for a couple of days. And so far as we can see, none of them have had any long-term problems, and most of them don't require exercise restrictions. They just get cardiology follow-up to be cautious. And so comparing the two, every cardiologist I've spoken to, and I've spoken to many of them, hands down, it's worse with COVID. Would we prefer the vaccine not to cause mild myocarditis? Absolutely. But this is what we've got, and it's way worse with COVID. So vaccine 100% is the better option.
And even for kids who have underlying heart disease, as well as some kids who we know over the summer get myocarditis from other viruses that are out there, those things are, we're still recommending that those children get the vaccine, because we wouldn't want them to get COVID and myocarditis on top of it.
Okay.
Yeah.
Okay, I'm going to do one quick last question. I'll ask for a quick answer, and then we'll go back to our slide to warn John to do that. Your child wakes up with a runny nose in the morning. What do? Should you do a test? What should you go to your, parents are just wondering, what do? Is it COVID?
So I actually had a phone call while I was on here from a colleague who has a son that she's picking up from school with a runny nose. I think, for the next 6 weeks, as we're moving into this surge, getting tested is what we need to do. We know that within the pediatric offices at UH and other healthcare providers around town, we're expecting it. And so, don't take a chance. Make sure you know what you're dealing with. I would definitely recommend a test. Amy or Joan?
I agree, and keep them out of school or daycare.
Yep.
Okay. Well, again, I hope you've seen some of the comments. People are so grateful to you all. First of all, for the work you do every day to help keep us safe. And we know this has been a long haul, and for you too, in a different way, and you're expecting the surge to come. So you're sort of just prepping for that. But I hope that the information people have gotten today may play a small part in preventing some of that, but certainly in helping us cope when it comes. So thank you all very much. And I'm going to ask John, can you switch to our universal pre-K slide now? And again, this will be available for everyone to see. We'll see if he's able to do that. Just so you all know that, again, children need preschool, high quality preschool. We are thrilled that we have 73 sites across the county that can accommodate up to 5,000 children. Scholarships are available for families. And we have a lot of data to show that kids who come out of our universal pre-K program do better in school than in a matched subject pool. So we're very family centered, and we encourage you to learn more, to go to our website. And John, if we can just show that last slide a little bigger. So we are the County Office of Early Childhood. Your county government, your tax dollars support this work and our universal pre-kindergarten program. So come visit us at investinchildren.cuyahoga.us. Follow us on Twitter at Cuyahoga Kids. And thank you all so much for being with us, our panelists who are amazing, as well as all of you in our audience. And with that, I think we're going to say, have a good afternoon. Bye.
Thanks for joining. Stay safe.
Thank you.